Hello, this is Dr. Gay from First Look MRI, and this is a 61-year-old male who fell about a week ago, has had posterior elbow pain. The physician suspected a torn triceps tendon, so we have an MRI here of the elbow joint. We're looking at it from the side, so this is a sagittal view. This is the antecubital fossa here in the front. This is the humerus coming down, ending here, and this is the ulna, and we can see the ulnar shaft here. This is the radius here. This is the radiocapitellar joint. Looks pretty good. No significant fluid. And here we go, the humerus and ulnar articulation here. So we're really looking back here at the triceps tendon. We can see that definitely there is a tear. So to help the surgeon out, we need to tell him what is going on. And it looks like there is a longitudinal component, a vertical band of fluid hemorrhage here, or edema, separating the triceps into a back superficial component and a front deep component. So the triceps tendon, there's three components to it. One is the long head, another is the medial head, and the other is the lateral head. The way I think about it is the long head, just to simplify it, comes off the glenoid, the infraglenoid tubercle, so off the scapula. And the other heads, the medial and lateral heads, come off the humerus. And distally, there's a long central tendon in the middle. That central tendon is made of two components. It's made of the long head and lateral head. And it comes down here, and it's the superficial one. We can see that's the one that's torn. It comes down here, it's wavy, and right here near the attachment, there's a little band. This is a little intact component right at the olecranon attachment, but right here there's a little tear, so a ruptured component here. Again, this is the superficial component from the long head and lateral head. Now there's another component about equal size here. This is the deep component from the medial head. And that has a tendon, and there's also some muscle fibers from the medial head here if we go across. So this is the medial head muscle. This patient has a partial tear in the medial head muscle, this bright spot here. And the medial head muscle comes down, gives off a central tendon here, and also some muscle components that come down here to the olecranon. And then again, this long central tendon from the medial head and lateral head is superficial. We see it's torn and stripped away from the deep component. And again, there's also a transverse tear right near the attachment. Now this patient also had a tear here of the lateral. This is the lateral head. It's part of the muscle. You can see the central tendon coming down, and then it ends there, and it starts back up here. So this patient has a high-grade tear here of the lateral head, including the torn separated central tendon. But the main takeaway point here is there are two components, the deep one from the medial head, and then we have the superficial one from the lateral and long heads, and they can be separated like this, and you can see the two separate components distinctly here. Usually they just blend together, you can't see them, so it's a good example of the anatomy of the distal triceps tendon.